Thank you very much, Mr Speaker. My question is to the Minister for Health. Will the Minister please outline the government's plans to improve the care provided to people suffering from mental health issues? What has been the reaction of the sector to these reforms?
The Minister for Health.
Thank you very much, Mr Speaker, and can I thank the member for Solomon for her question and acknowledge her interest in the area of health generally, particularly in mental health. And we do know that one of the areas of concern is the mental health of the fly-in, fly-out workforce. And the rationale behind these key reforms is that it won't be one-size-fits-all delivered from Canberra, but individual locations across the country will be able to pick up the policies they need, the consumer, person-centred driven initiatives that will make the real difference for individuals. I have been pleased, Mr Speaker, with the response to the government's reforms that I announced with the Prime Minister, Professor Alan Fels and Professor Ian Hickey last Thursday. But I'd like to pick up on a couple of further comments that have been made by people who we take very seriously in this sector. One is John Mendoza, who is actually Labor's former Chief Mental Health Advisor, a person of influence, an expert in his field and, above all else, a passionate advocate. And he described this as the most significant shake-up to mental health services funded by the Commonwealth since the beginning of the National Mental Health Plans. It's bold, it's brave, it's visionary. What was announced today, Mr Mendoza said, responds directly and decisively to the core problems in mental health care identified in a continual 10-year public critique and published in truckloads of reports to government. And that captures it, Speaker, because the most important thing we did in announcing these reforms was to listen to the sector, to listen to consumers, to listen to families, to listen to advocates, and to understand that in designing a reform that works for them, we have to and we had to hear their voices. John Mendoza goes on to say, we will see an end to the sort of mental health care system that mirrors the old Soviet automotive industry, the one car in one colour and only available after an eternal wait. Others have been similarly encouraged. Mental Health Australia welcomed the response, saying reform starts today. Beyond Blue, Black Dog, the Psychological Society, the Consumers Health Forum and Today, the Age newspaper, I was delighted to see its editorial headline, "The Government Gets It Right on Mental Health." Mr Speaker, as I said, this is a key reform and it's designed first and foremost to add the services, the professional expertise, the tailor-made individualised care packages for people who either suffer in an episodic way with mental ill health or who experience a lifetime of differences, if I can describe them like that, in mental health and need ongoing special support. I am delighted that from here on so many will be on board with this key reform, and I look forward to the support of all my colleagues as we go forward.
The member